Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles today. Join us as we cut through the fog that exists at the leading edge of healthcare technology and culture. I'm very pleased today. My guest is none other than Dr. Gary Wietecha, who is the Chief Medical Officer at MedTech Solutions. Dr. Gary, thanks for joining us today.
Hey, Jim, great to be here.
I know that MedTech provides services that support the alignment of EHRs, IT, and of course now AI-enabled workflows with a goal to improve operations, support clinicians, and enhance patient care efficiency. I know that, Dr. Gary, that you were delivering babies back in the days of paper charts. Tell me about when you first saw the twinkling in the eye of the healthcare digital expansion and saw the EHRs coming. What was that like for you?
It was an interesting concept. It started for me, in the 90s, I had a practice management system and they had an EHR that they started to put out there. And it was very high level in the beginning, but it was an intriguing concept. And when I left practice to become a workflow consultant, late 90s, that's really where I saw the impact of these systems. In the beginning, it wasn't documentation. It was more on the administrative, keeping the data, pulling the data together. Mm-hmm. And then basically I've watched it move into this world where providers were doing the documentation. So nursing doing a lot of work, providers seeing data, and then it transitioned into providers having to document their world.
I'm glad you mentioned that because I was working in a large specialty practice at that time, and suddenly providers became data input people.
It was interesting to watch because the nurses jumped on it real quick. The providers hesitant.
If you've been trained to document in a certain way, and then all of a sudden somebody says, well, here's a different platform we're going to be using, which involves clicking on a screen. That's a pretty big shift. And just in the way your brain has to be retrained.
Yeah. What I saw with that and what I've heard and observed over the last 27 years, let's say, with it, is that in the beginning, it was done to providers, for somebody selected a system because they wanted the documentation to capture the billing. And it wasn't done with the providers. They were forced to start using a system that really didn't reflect the way they thought about what they were doing. And that's where the biggest struggle has been. It was done to them. And, success comes from doing it with.
For a number of years, of course, my background is in healthcare delivery, but then I got into the EHR side of things, and I was I would travel to different practices to help them implement and adopt their EHRs. And I always felt sorry for the providers because what we essentially did was got them to the edge of the riverbank and then pushed them in the river real fast. And it was overwhelming for a period of time. So hopefully those days are behind us. But there's certainly a lot of folks like you who lived through that time of great difficulty, transition.
Yeah, things are getting better. I think the success that we're seeing is because of providers being invited to the table early. And the failures we see are where the provider is brought to the table afterwards, and IT, nothing against IT. I work with IT very well, but where IT leads the project, it is being built. The system is being set up, configured through the eyes of IT, which is about making technology work as opposed to having that technology augment the provider.
The vast number of those early EMRs definitely were designed by digital engineers
Yep.
with minimal input from clinicians, it seemed like to me.
And that's gotten better. Most of these companies now, the vendors actually have providers in. So the eClinicalWorks, NextGen, they have providers that are starting to jump in. However, it's still implemented by the IT team. The clinicians they really need to get out front there and be helping decide how it's going to work for them.
Let's talk about AI a little bit. Certainly in the back office environment, whether it's for billing or coding and scheduling and things like that, it makes perfect sense. But on the front side, providers' use of AI, what are you seeing? What do you hope to see going forward? Where are we at right now?
There's a lot of literature out there, a lot of research being done where AI is reducing burnout. And what's really interesting about it is that providers are jumping on the bandwagon. They want it because they really want relief from the EHR. And what I'm seeing is two things. One, the vendors are saying, oh, this can replace having to do all that point and click in the EHR. And so providers are like, ooh, get me this. And then they start to use it and they realize that AI is great, except it does not get rid of the work. It just pushes it to another point of the workflow. And so there's a great adoption going on. And it really is, people are adopting it. But then when they get to the other side and they look at the documents coming out, there's a trust issue. Is this thing really capturing the essence of what I'm doing? And that's where the fear comes in, because it's like, well, it does a great job. It captures it. It makes recommendations, but then the provider still is responsible for handling this, having to then, make sure it's working. And it doesn't work for every workflow either. That's the other thing that's coming up. It's great for some workflows, but it doesn't work on every workflow. And the organization has to know that going in.
We're always looking for applications that will be embraced rather than having to impose them on folks, providers in particular. My own internist about 6 months ago started using ambient AI. And so he would walk in, start running an AI ambient application on his smartphone, and it would capture the conversation and the findings and things like that. And of course, then he would review that note, but he found that of immense value. What are your thoughts? What are you seeing out there in terms of that ambient AI?
Ambient is great. It can capture the words. It can capture it. It is getting better and better every day. Ambient today is not the ambient of a year ago. It's really getting trained. However, once again, the provider has to review it, has to look at it. And then the other thing is a lot of the vendors started off with ambient recording and putting, a documentation into the system that wasn't discrete, which then affects your capture of quality measures and, the things that have to be codified. So, there's still work there. They've also not, it captures most things. The provider still has to go in and refine, make sure that it captured things correctly. So yes, it makes the appointment better for the patient and the overall patient experience phenomenal. The provider patient experience great. And then the ultimate is you have to go back in and make sure it did capture everything. But it makes great recommendations. It doesn't get it 100%. It's getting better. I'm hopeful that in the years in front of us, that this is going to be an incredible opportunity for clinics, for providers and nurses and everyone using it.
One of the things that I've noticed with it is when my internist was doing a physical exam with us before, he wouldn't say out loud, lungs are clear to auscultation, things like that. Now he needs to say it out loud. And so he was having to train himself a little bit to say things verbally that I used to just think about and document. It's
Yeah.
kind of interesting how you have to adapt up, to the sound issues that it has to hear what you're saying.
If you don't say it, before it used to be if you didn't write it, you didn't do it. Now it's if you didn't say it, it didn't capture it. And so, that gets to be interesting. And that's where the biggest opportunity is for organizations, coaching their providers on how to be effective speakers. You know what I mean? How to enunciate and to get things out for the system to pick up.
It seems like this ambient AI is very quickly being adopted. Do you see that? You see high adoption rates?
Yeah, I see a lot of people taking it on, wanting to try it. I have talked to providers who said they tried it, they didn't like it because they were quicker and more effective with their system because they've been working their system for 20 years.
Of course.
And they're better documenters. They can capture faster, more effectively than the system can. So it's not for everybody. But yeah, a lot of people are adopting. Once again, it's the trust issue because they have to make sure they're saying everything. And so there is still, is it doing everything correctly? Because at the end of the day, it is the person who's signing that is held accountable for it. And so I think adoption's coming on. There's also a cost with it, financial. You have to pay for this. It's a subscription service for, some give it free, but it's part of your system.
Sure.
But still, it's not for everybody. And, you look at the FQHCs and, systems, organizations with less money, it is a financial, risk for them to get this.
Kind of the next step may well be, and I think there's a little hesitancy to take it, is the agentic AI, where a provider may give a diagnosis or perhaps say, well, we need to order some liver function test or something, and the system will automatically issue and submit those orders. What do you think about agentic AI? Is that ready for prime time, or is that still a little bit iffy?
It's coming at us. It's sort of like a great white shark coming at us, and that's where some of the fear is, because it's going to take action on my words, and now it's going to be happening quicker than I can say it. You know what I mean? It's assuming things, and that's where we're going to really start to see the fear come up with did it do what I wanted? And all it takes is one of those orders to be wrong, and it's going to put some doubt.
Yes.
So organizations have to stay on top of it. And I think one of the other things that's going to help them win with this game is to phase it in and do the pilots with, your stronger AI users, have them take it first, do it for select workflows, because it has to learn. And it's learning from the provider. So if you have a weak AI using provider, they're not going to train it as quickly and not as strongly as somebody who really is great with this stuff. So there's a learning curve, not only for the provider, but also for the AI. And that's where it's going to get interesting.
Let me mention to our audience, if you just joined us, I'm Jim Tate. And on this episode of the Tate Chronicles, I'm speaking with Dr. Gary Wietecha, the Chief Medical Officer at MedTech Solutions. Something else that I've noticed, there's such an emphasis, whether even pre-AI, just electronic health records, this was going to certainly maybe be more precise, but also save a lot of time. And so I've got a friend, provider, and he says using ambient AI saves him maybe an hour a day. And so his office manager says, okay, great, you can see 4 more patients. And so it doesn't really, there's that push and pull on things. Do you kind of see that out there that, it doesn't really relieve the potential burnout of providers if we just save time here, but then just put more patients on?
Yeah, I see many things going on with that. It is all about volume. And in today's healthcare reimbursement world, the more you see, You have to see more patients. You have to become a machine with your ability to get this stuff done. The EHRs slowed us down. Now we have something called AI that's going to speed us up. It does save time, but not in all cases. And there still is some review down the road. You have to look at your note. You have to review it. You still have to read that note. So it does save a little bit of time. But as far as burnout, burnout comes from the fact that you're spending extra time, hours afterwards, that dreaded pajama time.
Yes.
Where you're working, providers spend 8+ hours extra after their day
I know.
working on their note. They're spending weekends, they're spending evenings. It psychologically is going to be taxing on us. It's also cognitive load when you are using the EHR. I think the biggest thing that AI does is it reduces the cognitive load, those, the dreaded clicks.
Yes.
And so I'm going to tell you about the clicks.
Good.
A lot of clicks going on. And people say, well, it's just mechanical. You just do it. You have to realize that every single click in an EHR is a decision that needs to be made by that provider. And so think of the cognitive load. There are studies out there say 4,000 clicks a day. That's an awful lot of extra decisions that you're making to document. So AI is going to reduce that. It's going to help with the burnout. And you know what? They probably can see the 4 extra patients, but it has to be, what are those 4 extra patients? And what are the issues that patient has? Everybody's trying to get more patients in, but not every patient is the same, and there are different things that have to happen. It's not as easy as bringing extra patients in. It's what's that cognitive load with each of them.
Dr. Gary, one thing I'd be interested in, kind of the work that MedTech Solution does. So if a large practice, maybe, over numerous clinics, maybe 30 to 50 providers, and they know they need help, but they don't know what help they need. And they reach out to MedTech. When y'all go in, do you do an audit? I mean, how do you figure out where efficiency and help can be given, and then how is that delivered?
Yeah, great question. So, and I'm one of the people that leads that at MedTech Solutions, and we offer many different types of programs that we can help people with. The biggest thing you need to know is that we approach the way providers use the system a little differently than vendors do, and maybe other consultant companies, because we're coaching. We are coaches, not just system users. So the people on my team come in, they shadow providers, and we can do it remotely. I shadow people remotely, or we get into the clinic with them, but we then look at what they're doing. And when you look at traditional training, it is a push. Somebody comes in and has a list of things they want to show a provider or the team and say, this is how you do it in XYZ EHR. And the person learns how to do the features and functions. Well, the important next step for that is to ask a question. And this is what it differentiates my team and MTS is we start off with Mr. or Ms. Provider, doctor, nurse practitioner. How do you think about doing this? So if you're trying to do orders, there's a way we on paper, or even the way we've done it in EHRs, is the way we think about pulling to get orders or documenting, an encounter. And that question then takes and what the way the provider thinks, and then moves them into, this is how you do it into the system. When you start from the perspective of the provider, you can help them create the synapse to using their EHR. When you just push features and function at somebody, they are saying, oh, that's great. It doesn't work for me. And I'm sure, Jim, when you were out there implementing, you heard that's all the time. I don't think this way.
Right.
Well, we start with, how do you think? And then we show them the crosswalk. there are systems out there that we learn in residency, and I'm not going to promote any systems, but they're great. And they're there when these doctors and nurse practitioners are learning. And then they go into private practice, or they go to another organization who uses a different system. What we do with our clients is we say, this is the way you did it there. How did you think about that? And then we say, well, this is the way your thinking would be translated to your new EHR. We create the bridge with them, and they go, oh, that's easy. Yeah, I can do that. When you show somebody, oh, this is the way you document this is the way you document this, it becomes a do to situation, and they're hesitant. It's like, whoa, I don't do it that way. And now we are all about creating that do with mentality and showing them how the system can support who they are as a provider.
Dr. Gary, you've touched on a real gap there that I'm all too aware of. There's one thing to be a provider, and then you and I have also been on the vendor side. And I implemented a lot of these systems into practices. And primarily what we were trained to do as implementation and adoption folks is to go in and teach them the software. There's really no thought about how they were thinking, how the provider was thinking, that bridge that you're talking about, which I guess is where MedTech Solution lives, is that bridge.
Yeah, we're bridge makers, and we're also we're experts on these EHRs. We can configure, we can do anything you want with your EHR, but the beauty of my team and the beauty, and this is the way I've been doing it because I came into this as a provider. I'm like, well, I don't think that way. I've always looked at it that way. That's why I can help people. It's like, oh, I know what you're thinking. Well, tell me what you're thinking right now. What do you want? What do you think you should be doing? So, it really is the bridge. The other part of that, and this is another thing that we do, we are advisors. We have a whole advisory component to our organization, people that are experts in the field, clinicians and IT and everything. There is all about change management and building provider champions. I was a provider champion. I've had provider champions in my organizations. So it's all about developing those people to have that same conversation I just talked about. It's about saying, this is, a provider champion saying, this is how I thought about it, and this is how I made it work. And it's a conversation. And I think when we collaborate and we create a do-with environment, we then are really finding the success. And organizations that do that naturally go miles ahead with AI, any technology. By the way, you don't just do this with the providers, you have to do it with their clinical support staff.
Sure.
And everyone else. It really is, if it's the end user isn't involved in the conversation and isn't trained to think about what they're doing and how they think about doing it, that's where you're going to get resistance, and that's where things are going to break down.
And there really has to be buy-in, as you say, really from the top down, from the administrative folks all the way down to folks involved in generating the billing and scheduling follow-ups and everything else. There really has to be a buy-in, really from top to bottom. And it's a lot easier if the technology is embraced. And if we can show folks the advantages and how it helps, as opposed to you just need to learn this, it's a whole different learning ramp, for sure. We're almost out of time. Please tell me and our listeners how we can find out more about MedTech Solutions.
Yeah, you can visit our website at medtechsolutions.com. On there is information and, of course, all of our services. And to find more out about get those provider type services, you can select on an area called ProviderCare.com. That is what we call it, or ProviderCare, not ProviderCare.com.
Sure.
But ProviderCare links, it's really all about clinical and operational transformation. We're workflow people. The people I work with are advisors and workflow experts, and we're really here to serve and help our clients get to that next step of adoption of any technology.
Sure. Give me that website one more time, Dr. Gary.
Yes, www.medtechsolutions.com.
To our audience, thanks for joining me on this episode of the Tate Chronicles. And of course, I offer a special salute to my guest today, Dr. Gary Wietecha, the Chief Medical Officer of MedTech Solutions. Dr. Gary, thanks for coming aboard today.
Thank you. It was a wonderful opportunity. I appreciate it.
I've enjoyed it. You can find more information on this show's program page at healthcarenowradio.com. That's healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.